And our next question and the top questions about LASIK, we're going to talk about side effects. So it's a very natural, question that people have in their minds is, I had this procedure done. What can I expect after the procedure? So are there any sort of temporary or long-term side effects that a patient should be aware of before they decide to have this procedure?
Well, in addition to the mild discomfort immediately post-op for the first day or so, some patients, especially with higher corrections, may notice some glare at nighttime for a short period of time. That generally resolves. That used to be more of a concern with the early versions of LASIK, with the early lasers that were available. The lasers now have gotten really, really good, very, very accurate. So nighttime glare and halo is exquisitely unusual now. Secondly, patients may experience some dry eye. And it's not a big thing. It's not a long-term thing for the vast majority of patients, but you may feel a little drier for the first month or two. So I recommend patients immediately post-op to take breaks more often. And indeed, this is just a good long-term practice. Take breaks if you're doing a lot of reading, computer work. So then just blink the eyes, close the eyes, and then it will all go back to where your norm was post-operatively as far as a dry eye perspective. If you had dry eye pre-op, you're going to have it post-op, but it may be a little bit worse for the first month or two, and then it gets back to your baseline again, and we can take care of that as well too.